Hello and welcome, class, to Chapter 17, Drug Use, Forensic Toxicology, Workplace Testing, Sports Medicine, and Related Areas. In this chapter, we'll be discussing what I wrote is as far as testing for any drug use and forensic toxicology, testing for workplace, and sports medicine and any future testing that is coming into progress as the times have changed and the drugs have changed. So we get introduced to new methods on how to test individuals to see if they're using different kinds of drugs. So we'll first talk about the terms as far as abuse and addiction. What is the difference between the two? Well, abuse basically means the improper use of a substance. For example, say you're taking cough syrup that has codeine included. Well, at first, you might have been taking it the correct way, the way the doctor has prescribed it. Then all of a sudden, you like the taste of this codeine, so you start mixing it with your different drinks and you start drinking it on the regular basis because it makes you feel good. Hence why little Wayne always is in the hospital because he's always taking Sipserb, which is codeine. It's cough syrup with codeine in it, and it can cause chronic heart problems. That's abuse because you're improperly using a medication that's supposed to be used properly. Addiction is when you can't get enough of something. You always relapse to it, such as alcoholism. Sometimes they can go through rehab and get all their merits and go through the AA classes and graduate from it. And then as they say, they fall off the wagon and they start drinking again. That's an addiction where you can't live without it. You're dependent on it no matter what the consequences are. You know it's bad for you, but you can't live without it. That's addiction. So abuse is improper use of it. Addiction is relapsing, doing it no matter how harmful it is to you because you got to have it, because you got to have it. The next term we'll talk about is illicit drugs or illegal drugs. Illicit drugs are those that are not prescribed. Prescribed drugs that can turn into habitual drugs are basically like your Ambien, your um, oxycodone, your Xanax, your Adderall, your Valium. These are all prescription drugs. They're not illegal or illicit drugs. When they talk about illicit or illegal drugs, they're talking about the marijuana, the cocaine, the heroin, the hallucinogens, the inhalants that they're talking about. Another type of um, illicit drug can be even as far as your over-the-counter drugs to make another drug, such as the reason why if you want to get a higher dose of um, the sinus medicine, you have to go behind the pharmacy now, and the pharmacist asks for your driver's license before you can get the higher dose of sinus medicine because they were taking the higher dose of sinus medicine and making methamphetamines with it. So that's what we would consider an illicit. It's illicit, but it's legal because it's over the counter, but it's the way they using it for is make it illegal. Some prescription painkillers can be considered an illegal drug, especially if you have your pain medicine that's prescribed to you, but you give it to somebody else and they get tested for a drug test and they say, well, you're not prescribed this medicine. Where'd you get it from? That's considered an illegal drug because you received a painkiller from somebody else and you tested positive for benzos and you're not prescribed this medicine and you have no record of it and you can't tell that it was yours or not. That's when it comes into the illegal drug area because you acquired it illegally. That's why you're not supposed to share your prescription medicine with somebody else. The role of a healthcare worker as far as drug testing is basically we will be involved in the pre-employment assessment of it. Say, for instance, we might be responsible for collecting a urine sample or collecting a blood sample. It might be due to insurance policy. They have to get drug screened in order to receive this new insurance policy. Or it might be something you might be a healthcare worker working in a, a company where they randomly test their employees just to make sure that they're not coming in intoxicated or high or anything illegal. And or you can work for the state and just do it because it's court ordered to do so. So we are responsible for collecting these specimens from these people who have to acquire them. And that is our main role in drug testing. We also come into play as for drug monitoring. Some patients are on antidepressant medicine, and to make sure that they're using their antidepressant medicine correctly and not abusing it, sometimes they have to come in and do lab work in order for us to make sure that they're using it properly. So that's drug monitoring. As far as to see if pregnancy or organ transplant, we will perform a test, especially if pregnancy, because they don't want the fetal or the neonate to come out with an addiction. So we would do drug testing on a pregnancy woman. Or if you're doing an organ transplant, they don't want to take organs from a person who's been a chronic user of a certain drug. They can't take that organ, so they would test them out to make sure that they are healthy 100%. We also monitor people who are taking a certain type of pain pill to make sure they're not abusing it. And we're testing to see for toxicology purposes also, because some medicines, no matter how good it's supposed to help you, sometimes it can hurt you. So we look to make sure that the medicine that you're prescribed or that you're currently on is not causing you to have a toxic reaction, such as digitalis is good for the heart, but if you take so much of it or you don't monitor it correct or the doctor doesn't monitor it correctly, it can turn to digitalis toxicity. So we don't want that to happen to a patient. So sometimes they'll go in for drug testing for that also. We also sometimes have to do drug testing for legal investigation. Say someone comes into the ER and they had an accident, first thing we have to do is do an alcohol level on that person just to make sure that there's no alcohol influence or any other drug influences. So usually if we get called to the ER, as a phlebotomist, we usually have to draw a drug screen and an alcohol level besides their other lab work, such as CMP, CBC, the routine. We call it a rainbow draw because we pretty much draw every test that we possibly think of, and we draw almost every tube that we can possibly think of. Also, our job is to make sure that a specimen isn't altered or tampered with. Um, I know when I did outpatient labs, um, when I worked in outpatient, we had a drug rehab center. Every so often, they'll bring their clients over to make sure that they're staying on program and not relapsing into going back into their use of their addicted drug. So we would have to conduct urine tests, which basically we make them empty out the pockets and we would make them leave a crack in the door so we can see them urinate. And when I say see them urinate, I mean not actually standing there watching them urinate, even though some places you do have to do that. But we have to make sure they empty out their pockets and they don't have any chance of altering their sample, meaning the old somebody pee in a condom trick and I'll keep it warm by my own body heat and pouring it in my urine cup when I go to get tested. That's tricks we have to be mindful of. That's tampering. That's what we have to look out for to make sure. Or they'll use their own urine and dilute it with hot water. That's why most labs don't have hot water in the bathroom. Both sides are cold, so they can't tamper it with it. And most urine collection cups have a temperature gauge. So if it's not body temp, it's been tampered with. It's always what I say. No temp, been tampered. So that's what we have to basically watch out for when we do drug testing. Substance abuse and addiction impact. The reason why most companies or most job force places look for these to randomly test their employees is because maybe they notice that their production level has gone down. They're not outputting as much work as they used to before, so they get a little suspicious on what's going on with them. They might be doing something erratic or chaotic or out of the norm that they usually haven't done. Um, could be simply as to be crime related or legal fees or just everyday, just general health. Sometimes we would collect on a drug screen just to make sure that the person is okay. Just random, especially if they're on a lot of prescribed medicines that can be harmful to the human body. We'll do a random drug testing just to make sure that they're sticking to their prescribed medicine and not going in outside sources to get the medicine that they need when their meds run out. So it's for their safety as well. With the development of smaller collection devices, screening techniques, clinical laboratory automation, molecular advances, and computer technology, it has increased the variety of laboratory testing options that are available for diagnosing and treatment of drugs of abuse and analyzing of specimens in remote locations for crime scenes. So this also falls into forensics testing also. So that really gives it a good background as far as how times have changed to where we can now test more advanced. Back in, in the 70s, we can take those unsolved murder mysteries or those unsolved crimes, or somebody who may have been wrongly accused based off of DNA testing back in that time, and take those same tests and test it now. We might not come out with the same analysis as we did back in the 70s as we do now in the 2000s. So as time change and equipment changes and technology changes, it changes the way how we detect drugs use, abuse, and how we can decipher a lot of criminal crimes through forensics technology due to the advancements of different ways we can screen for analysis. Res- the responsibility of the collector. Because we are in the healthcare field, and especially us as phlebotomists, we do play a big part in some of it and a minimal part in some of it. Um, First and foremost, we always have to identify both donor and substance. We have to make sure that the specimen that we collected is from the person who donated it to us. So if we're collecting a urine test, we have to make sure that the urine test that we collected that's going to be drug analyzed comes from the person whose name is on that cup. So we're responsible for identifying this person to make sure that we have the right person that we're supposed to be collecting the sample from. We're also responsible for not letting them alter it or substituting the urine or substituting the sample itself. We always have to make sure that it's tamper proof. And when we say tamper proof, basically, like if we're, say, for instance, and I always refer to urine because that's a lot of the times that's what we collect. Very few times we'll be lucky enough to collect a forensic case file, a criminal file. The 10 plus years I worked in the lab, I think I collected one time for a forensics case, and you basically have to make sure it's tamper proof. Matter of fact, before you can even go in the room with the person who's been violated, or you going into that area, and it was just you're gowned up with PPE from your head to your feet. Basically, you have a bonnet on your head, you're in PPE, you have gloves on, you have goggles on with a face shield, you have booties on your shoes. When I say they want it to be tamper proof, for you not to be not to be tampered, and it's nothing on you is pretty much exposed. You are sterile. You have to also make sure that you follow your chain of custody, that every time it's handed off to you, that you initial it and date it and time it, put the time on it. When you have it, when you're handing it off, you have to make sure that person signs it in with their initials, the time they collected it, and the date, time and date they collected it from you. So it's kind of like you have to follow that chain of command all the way through, because if one link of the chain is omitted or not documented, then that makes that specimen pretty much you collected the specimen for no reason, because it didn't follow the chain of command. It wasn't authorized to go through the channels because it somebody forgot to initial sign and initially dated and timed it. So we have to be very careful when we're dealing with the chain of command. And it must be always document, document, document. Always have accurate documentation and legible documentation, because everything we do in the lab, especially when it comes to drug testing and forensic testing, we have to be mindful of accuracy and documentation. It has to be accurate. And when in doubt, use the whole word. If you're not sure of what a medical term is supposed to be or a medical abbreviation, write the whole word out. Now we're going into drug analysis. Drug analysis has different types of tests. You have initial screening tests, and then you have confirmatory tests. Initial screening tests are basically rapid tests. Rapid test that just says, okay, this person's on benzos, this person is on obituates, this person has cannabis in his system. Well, what if you get a test, you did an initial screening test, and see, on a drug test, it comes out with lines. They're either dark, 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 or faint, faint, faint. They're either going to be dark, dark, little dark, or faint. Now, the ones that are kind of iffy, excuse me, like you see the line, but it's not defined. It's very light, 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 light. That's when we would do a confirmatory test, because it says it's positive, but you're not sure if it's positive. So basically we would go an extra step to confirm that yes, this person was taking obits, this person was taking um, benzos, this person was um, on cannabis. And if we do prove that those faint, faint lines on an initial test were actually really positive, like truly, truly positive and not false positive, then we would do a paper trail. Okay, are you on different kinds of medicine? No. Well, then you test positive for those signs. So we have to do initial tests. It's a little more legwork, but it's for the patient's benefit as well as the employer to know the truth about. A drug metabolite. Basically, what a drug metabolite is how fast does the drug react to that person's body. There are different factors to that. How fast can it be absorbed into the person's bloodstream? How fast can it be absorbed into the urine? How fast can it absorb into the body's tissue? That's what a drug metabolite is basically how fast can it react to a person before they become impaired. Some people can drink alcohol from sunup to sundown and it does nothing to their physical aspects of their job performance. They can work a 9 to 5 and have no ill effects. But if another person does the same thing, they may become tipsy, they may become disoriented, they might slur their words. It just depends on how fast can this drug react to a person's body. That's what a drug metabolite is. There are certain windows of detection, and basically what a window of detection is a period of time to where we can detect when a drug was used or what kind of drug was used and how often this drug was used. Well, maybe not frequency of how often is used, but it can basically say this person has used and when. A year ago, 5 years ago. So it can't say it that that person did it every day, 5 days, 5 hours a day, it can't be that specific, but it can definitely say, well, they used it last week or they used it a year ago or 5 years ago, depending on the sample, because there are a variety of ways we can collect the sample to test for drugs. We can do urine, we can do hair, and we can also do blood. We can also tell how much they used of a particular drug. We can also determine if it was inhaled, ingested, injected, absorbed. How was it? And how fast did the drug metabolize within that body? And what is the cutoff concentration of that particular drug? That's a window of detection, what it can affect. Now, we all know that a drug metabolism only can go so far. It depends on how much the body can absorb or how fast that drug absorbs into the human body. So you have to take into fact that the user's physical condition, are they healthy? Are they not healthy? Are they an abuser and they use it all the time? So therefore their physical condition plays a big role in the window of detection. How much body fat they have, how much they weigh, as you know, with cocaine users, after a certain time, um, they start to lose weight and they can't keep their body mass or they can't keep their body weight. Um, we also look for if they have any kidney disease, heart disease, lung disease, any type of COPD. What other pathologic effects do we have to count into play in this window of detection? We have to make sure the stability of the specimen that we collected is properly collected because that plays a big factor into our window of detection. If our specimen wasn't collected properly, during the pre-analytical, pre-examination phase of it, then we have an erroneous test and we have to start our window of detection has gone out the window because we didn't collect the specimen correctly in the first place. So we have to make sure that our stability of our specimen is right on point when we're collecting and analyzing for window of detection to see how often this person has used it or what was the frequency use of it. When we're testing for drug use or drug abuse, we are basically looking for depressants, hallucinogens, and stimulants. Those are the basic ones we pretty much look for when we do drug testing. Um, Depressants can be anything from opiates, um, barbiturates, alcohol is considered a depressant. Our stimulants we pretty much know as cocaine, um, and our hallucinogens are LSD, marijuana, and other types of drugs. We also look for um, the blood alcohol We can also do blood alcohol analysis. These are the different ways we can look for a drug is through blood alcohol analysis or blood testing for any other drug. We can do urine, we can do saliva, oral fluids, venous blood, hair. Um, those are just the different specimens we can collect in order to do a drug test. We can also use a a breath analyzer to see if anybody's has been drinking and driving. Breath analyzers. We can even scrape under the nails. We can use meconium or stool, somebody's sweat to test to see if there's any drug abuse problems. Those are just a couple of specimens we can use as test samples. Um, the basis one I used was blood and urine. I, but if you go to like CCOM, they do further tests. They do hair, they'll scrape on your nails. They might, and then, if you're drinking and driving and they come to a roadblock or whatever, they'll do a breath analysis test on you to see if you have any alcohol in your system. The one thing drug testing cannot do is it can't measure how often that person used this drug or the frequency of use of this drug. It can't tell how impaired this person is because different drugs react to people different ways. So we really can't use a drug test to determine the degree of impairment that this person can be in because, like I said, somebody can drink alcohol all day every day and not be affected, and then another person can drink alcohol all day every day and it can affect them. So it doesn't really count as a degree of impairment because some people can live like that all the time and not miss a beat. It doesn't tell anything about a medical disorder. It can't say that somebody is medically disordered, or it cannot distinguish between, especially if somebody is on, if you do a drug analysis and somebody tests positive for obits, well, we can't tell if it's an illicit drug, a over-the-counter drug, or a prescription drug. We can't tell. That's when we go into our paper trail and we would ask the patient, okay, what prescribed medication are you currently on? And that's usually how we can tell, okay, that's why they test positive for obits because of the medicine they're on. Or that's why they test positive for benzos because of the medicine they're on. But if they can't give you a paper trail and tell you what meds they're currently taking, or those meds that they are so say taking aren't their prescribed medicine, they have no doctor's orders to prove that they're the ones who are prescribed that, so they can get in a lot of trouble. So drug testing can't tell you if it's prescribed, over the counter, or illicit. It just can't. There are different drug testing methods that can be used. We have point or POC immunoanalysis or IAs. We have gas chromatology or GCs or mass spectrometers, MS, or high performance liquid chromatographies. Right? So these are the different methods we can use to analyze drugs for testing. Just for an example, so depending on what test or what method you use, if you're using for example, a point of care immunoanalysis or IA, this is usually just a low cost, rapid turnaround time type of test. It usually only analyzes what's there at the moment. excuse me. But if you use a gas chromatography or a mass spectrometer, it has a high degree of what specific drug it will detect. So it's more or less a confirmed screening. Those are confirmed screening tests. So depending on what method we use, you can say, for instance, and still these tests are faulty too, because due to the fact that some drugs that you ingest from everyday food can cause you to test positive for other things, such as everybody, well, not everybody, but some people do like the lemon and poppy seed muffins. Well, if you eat too many of those lemon seed, poppy seed muffins and you go in to do a drug test, you can have a trace of morphine or codeine in your system from a poppy seed muffin. Such as if you drink cocoa leaf tea. If you drink enough of this, or if you drink this enough or enough times and you just happen to go in to do drug testing, you can test positive for cocaine based off of these. So not all drug testing can be accurate, because remember I said it cannot detect what kind or how you took it, if it's over the counter, if it's prescribed, or if it's street, or in this case, if it's ingested foods that you eat. Um, Such as if you eat a honey bun and you get stopped for a breathalyzer test and you're eating a honey bun, that honey bun will give off an alcoholic level of a zero point 0.8 level. I mean, yeah, it'll go down after a time, but when you first breathe in it, you have an illegal rate of alcohol in your system from a honey bun. So these tests do have their faults. So that's why it's good to always document and to ask questions, and to double check and to make a paper trail. Stability of documentation. So we don't accuse somebody of something that they didn't do. Um, s- Such as ibuprofen. You don't want to take meds, prescription painkillers, so you wolf down ibuprofen. Well, ibuprofen can cause you to have a false positive for barbiturates, benzos, or cannabis. So we have to be really mindful of how we test or what type of test we use. Another reason why we do drug testing is, especially on neonates or pregnant mothers, if the pregnant mother has a record of being an illicit drug user, we would definitely do drug monitoring and drug testing on the mother to determine, to make sure that she hasn't been taking any illicit drugs while she was pregnant. And if she so did happen to take it, how often or how much, according to the mother's drug metabolism. We have to determine how much did she use, did it affect the baby, was it harmful to the neonate, and if the baby comes out premature or low in birth weight, we also have to check the baby to make sure he's not addicted to the drug of preference that the mother had used. So those are things we do as far as neonates are in a pregnant mother, that we check to make sure, especially if she has a history of drug abuse, illicit drug abuse, or even prescribed, because you can abuse it, a prescribed medicine. So we have to be mindful of all these things when we're doing a pregnant mother or we're testing the neonate themselves. When we're collecting specimens from a neonate, usually we'll take it from their meconium, which is usually their first bowel movement when they come out of the womb. Or if the baby has hair, if the neonate has hair, we'll take a hair sample. Or we will test the baby's urine when he does do his first urine. And as far as the mother, we test the blood, the mother's blood, the amniotic fluid that the baby was in, the placenta, the cord blood, and oral fluids to see if she was recently using or yeah, to make sure she was to check to see if she was recently using while she was pregnant and how often and how much. This concludes drug analysis and our role in it and what we do as far as when we're testing for drug abuse of an individual, such as a neonate or a pregnant woman or an individual in themselves. Our next lecture, we will be talking about forensic toxicology specimens, why it's important that we collect forensic specimens properly and accurately, and to follow the chain of command or chain of custody. And we'll go into that further in lecture, chapter 17, lecture 2. I hope if you have any questions, you are free to text me at any time or message me through Emoto. I hope you enjoyed this lecture and I'll talk to you soon. Bye bye.